name's Elizabeth. I'm one of the nurse practitioner students. I understand that you're here for a physical today.
Yes.
Okay, perfect. Let me just wash my hands and then we'll get started. Okay. Alrighty. I would like to videotape this if I have your permission and post it on the internet. Do I have your consent to do that?
Yes.
Okay, strictly educational. Okay. Can you tell me your date of birth?
January 9th, 1971.
Okay, and your age?
54.
Okay, and your sex?
Male.
Okay, and your race? What do you identify with?
White. Caucasian.
Perfect, perfect. Okay, so we're going to go ahead and get started. We're going to start with some past medical history. Tell me about any of your chronic conditions.
I have hypertension.
Okay.
I also have insomnia. I have cold sores. That's about it.
Okay, all right, fabulous.
Yeah.
Okay, so do you have any history of mental illness?
No.
Okay, perfect. How about any history of infectious diseases?
No.
Okay, well, so how about your surgical history?
In 1990, excuse me, in 1990 I had my wisdom teeth taken out.
Okay.
I had to stay overnight because I was in the I lived in the dorms in the military.
Okay.
In 2009 I had LASIK. In 2011 I had a vasectomy.
Okay.
In 2008 I had a bunionectomy.
Okay.
I also had another one on my other side in 2022.
Okay.
I also had trigger finger in 2019 in my right hand. Yeah, that's about it.
Okay, all right. Any trouble with anesthesia?
No.
Okay. Any allergies to medications?
No.
Okay, so speaking of medications, can you tell me what you're currently taking?
I'm taking amlodipine 5 milligrams.
Okay.
I'm taking Valtrex. I'm taking Trazodone 150 milligrams. I'm taking magnesium. I'm taking lysine.
Okay.
I take a multivitamin and I take melatonin.
Okay, great. So how about history of hospitalizations or injuries?
Like I said, I had to stay the night in the hospital and I had my wisdom teeth taken out because I lived in the dorms. I was in a motor vehicle accident and fractured my right hand.
Oh my goodness. Okay. All right, shifting gears a little bit. Are you up to date with your childhood vaccinations?
Current.
To the best of your knowledge.
I'm current.
Okay. And what about the flu vaccine?
I get it this week actually.
Oh, perfect.
Sunday, yeah, this week.
Okay. And how about the COVID vaccine?
I had 3.
Okay.
So I had 2 mandatory and then 1 booster.
Okay. Okay. Great. Let's see. Your vaccines.
Oh, and one other surgery I said I had a vasectomy. It was in 2009. I can't remember if I told you that.
Okay. Okay. Perfect. Good to know. If you were a female, if my patient was a female, I would ask about menstruation. I would ask about when it started and any characteristics of her cycle. If my patient were an older woman, I would ask about menopause, when she hit menopause, at what age, and ask about any symptoms that she might be experiencing. All right, so tell me about your sexual history. Current partners.
1.
Okay, all right. Any history of sexually transmitted infections?
No.
Okay. And any type of birth control used or not used?
No. I have vasectomy.
Okay.
Yeah.
Okay. Just wanted to make sure. All right. Okay. So now I'm going to get some information about you regarding your social history. So can you tell me where you were born?
Sanford, North Carolina.
Okay. All right. And what race and nationality do you identify with?
White.
Okay.
Yeah.
All right. And your marital status?
Fiance.
Okay.
I have a fiance.
Oh, well, that's so nice. Congratulations.
Thanks.
Okay. And what is your occupation?
Medical assistant.
Okay. Well, I believe you did say you had some military history.
Yes.
Okay. Are you currently still?
No, I'm retired.
Okay. All right. Fabulous. Okay. So tell me about your living arrangement.
I live with my fiance with 3 cats.
Okay. In a home? Do you rent
A home.
Or do you an apartment? Okay, but
Yeah.
in a home. Okay. So let's talk about dietary habits. Do you ascribe to a particular diet, or you just eat whatever?
I eat whatever.
Okay.
Yeah. I try to go to the flexitarian diet,
Okay.
but it comes and goes.
Okay, I gotcha. So what about your usual caffeine intake?
I usually have 2 shots of espresso in the morning
Okay.
before I go to work, and then I very rarely, but sometimes have 2 more in the mid-afternoon.
Oh my goodness, that's a lot of caffeine. Okay. And do you get exercise?
Yes.
Okay. What kind of exercise do you get?
I play racquetball. I try to play at least once a week.
Okay.
I walk between 3 and 4 miles at work.
Okay.
And I hang out with family and friends.
Okay.
So, yeah.
All right. Great. Do you have any history of tobacco use?
I used to chew, but I quit back in like 2004.
Okay.
Yeah.
All right. So it's been quite a while.
Yes.
All right. Any history of vaping?
No.
Okay. Alcohol consumption?
Not anymore.
Okay. How about history of recreational drug use?
No.
Okay, fabulous. So tell me, how do you deal with stress?
I play racquetball, and I actually talk to my fiance.
Oh my goodness.
I know, right?
That's wonderful, right? Okay. So how about your sleep? How many hours a night would you say you get on average?
I would like to think I get 8. Maybe between 6 and 8.
6 and 8?
Yeah.
Okay. Do you feel refreshed when you wake up?
Most of the time.
Okay. All right. Great. Tell me about your hobbies.
Right.
How you spend your leisure time.
Family, friends. I play racquetball. I used to fish.
Okay.
It's starting to get cold now.
Yeah. That's probably kind of tough.
I don't do that. I don't do cold weather anymore.
Okay.
So, yeah.
Alrighty. Wonderful. So let me see what else I need to know. I can't think of anything else right now. Do you own any guns or weapons?
Yes.
Okay. Are they secured?
They're all secured.
Okay. All right. Wonderful. Do you wear your seatbelt?
Yes.
In the cars?
Mm-hmm.
Okay. Perfect. Okay. I think we got a pretty good background. So now I am going to ask you about your family. Do the best you can.
Mm-hmm.
So we'll start with your grandparents. Are they
deceased?
Both are deceased. Okay. Do you know about how old they were when?
My grandmother was 83 years old.
Okay.
My dad's father died when he was 11.
Okay.
I don't know too much about my mom's dad or my dad's mom, so.
Okay. All right. No worries.
Yeah.
Do you know the cause of death?
Of which one?
Of either of them. Of both of them.
Old age.
Oh, okay.
I think my dad's father had a heart attack.
Okay.
And then my grandmother, she died in the hospital.
Oh my goodness.
Yeah.
Okay.
So.
Alrighty. What about your mom and dad? Are they still with us?
Alive and kicking.
Okay. Great. And do you know their ages, approximate ages?
My dad is 77 and my mom's 76.
Okay. And how is their general health?
With meds, they're good.
Oh.
My dad just went through aortic valve replacement, so
Okay.
like less than a month ago.
Okay.
So.
Alrighty. Do you have any siblings?
I have one brother. He's 3 years younger than I am.
Okay, so that would make him 51?
Yes.
Okay, 51. How's his health as far as you know?
It's okay. It's good, I guess.
That's
I mean, yeah.
Okay.
Yeah.
Alright, great. Okay, so I'm going to run through a bunch of diagnoses. If any of them are applicable, just shout it out.
All right.
Okay. So any history of headaches or dizziness?
No.
Okay. How about cataracts or glaucoma?
No.
Okay. Any epistaxis?
No.
Epistasis.
Mm-hmm.
Okay. Any history of prolonged sore throats?
No.
Okay. Any deafness?
No.
Okay. All right. Any history of seizures, migraines, Parkinson's?
No.
Okay. All right. How about hypertension, strokes, myocardial infarctions?
Hypertension.
Hypertension.
Yeah.
Okay. All right. So how about any asthma or COPD, chronic bronchitis?
No.
Okay. All right. Any history of abdominal aneurysms, GERD, ulcers, hiatal hernias?
Me? Oh, I forgot about that surgery. I just had hernia surgery, actually.
Okay.
Last year?
Okay.
2024, yeah.
Okay. Well,
So new, I forgot.
All right. I'm glad that jogged your memory.
Yeah. Yes, I had hernias.
Okay. All right. So, any pyelonephritis, kidney stones?
No.
Okay. Let's see. What else? How about any gout or arthritis?
Me?
No. This is your
Oh,
family
yes.
history.
My family has arthritis.
Okay.
Yeah.
Okay. Let me see. All right. Any history of diabetes or thyroid issues?
Thyroid issues.
Thyroid issues?
Yes. And there is diabetes in my family, just not in my, I don't think my mom has it.
Okay.
I know it's there.
Okay.
So. Yeah.
All right. Any hemophilia or vitamin K deficiency?
Mm-mm.
Okay. How about any ALS or Huntington's disease?
No.
Okay. All right. Is there a history of obesity?
My aunt was obese. But, yeah.
Okay. All righty. How about some history of cancer, skin cancer, colon cancer, lung cancer?
My dad had skin cancer.
Okay, he did have skin cancer.
And I believe now that you say cancer, I believe my dad's mom might have died from cancer.
Oh my goodness.
Yeah.
Okay.
I wasn't really close to him, see, so.
Gotcha.
Yeah.
Gotcha. Okay. So are there any familial allergies?
I don't think so.
Okay. All right. Let me see. Any history of anxiety, depression, schizophrenia, bipolar?
No.
No? Oh, well, you hesitated just a moment.
I was
so.
just thinking of who in the military doesn't have anxiety.
Okay.
Yeah. Yep. So, yeah, I guess.
Okay, great. Alrighty. So it looks like we have a pretty decent picture of your family history. If anything pops up, you remember anything, just let me know. We'll add that to the chart. Okay, so I think what we're going to do next is we are going to get some information specifically about you. Okay?
Awesome.
Yes. Okay. All right. So, are you having any trouble with your vision?
No. I wear glasses, so. Yeah.
Okay. But you haven't noticed a change?
No.
Okay. Do you ever have double vision, tunnel vision?
No.
Okay. Do you ever see little floaters?
Sometimes.
Sometimes.
Yeah.
Okay. And when was your last eye exam?
2 years ago.
2 years ago. Okay. So how about do you have any issues with your hearing?
No.
Okay. Any pain? Any ear drainage?
No.
Okay. All right. Any history of epistaxis?
No.
Okay. Or nasal discharge?
No.
Okay. All right. Do you have any trouble eating, chewing, swallowing?
No.
Okay. All righty. All right. So let's see. All right. Do you have any trouble with your gait or with balance?
No.
Okay. Any unilateral weakness?
No.
Okay. Any dizziness or headaches?
Mm-mm.
Okay. How about any numbness or tingling in any of your extremities?
No.
No. Okay, great. Cardiovascular. So do you have any chest pain, any heart palpitations?
Nope.
Okay. Any shortness of breath?
No.
Okay. How about any dyspnea with exertion?
No.
Okay. What about a lingering cough?
No.
Okay. All right. So are you having pain in any of your joints or muscles?
No.
Okay. Are you, do you have any sensitivities or intolerance to heat or cold?
No.
Okay. Have you had any unexplained weight loss?
No.
Or weight gain?
No.
Okay. Have you noticed an increase in perspiration?
No.
Okay. Any unusual hair loss?
No.
Okay. Let's see what else. And we already asked you about allergies. You don't have any allergies. What about any environmental allergies?
No. Oh, I might have hay fever. I've
Okay.
been told.
Okay. Okay. All right. Okay, so I think that probably sums up all the questions. So we'll go ahead and get started with the exam, if that's okay. Okay. So can I get you to go ahead and sit up on the table here for me? Okay, so first I'm going to start with assessing your skin, your hair, and your nails. Okay, so I'm just going to go ahead and take a peek inside your shirt here. Okay, all right. Okay. All right, so while I'm doing this, I'll tell you a little bit about what we're doing. So I'm assessing for skin color, for pallor. I'm checking for any growths, any asymmetry, okay? I'm not seeing any now. What I'm going to do is I'm going to test your skin turgor. Okay, all right, you've got great skin turgor. It was a quick return. So while I am doing this, I'm also going to assess the temperature of your skin, all right, of your extremities, okay? I'm also looking for any signs of evident edema, and I'm not seeing any, okay, which is a really great thing. So also what I'm doing is I'm just going to take a look at your hair. I'm looking for texture and just any unusual hair patterns, okay? So you have very thick hair.
I do?
You do. Yeah, you do. You have some thick hair here. I see it is thinning a little bit, but okay.
It's what?
Thinning.
Oh, I didn't hear what you said.
No, that's okay. That's okay. You're fine. So while I'm assessing your chest, I was looking for any scars, any nodules, any masses. I didn't see any. So one of the things that we look for when we do our skin assessment is we're checking for the nevi. So nevi is just another word for moles. So on your back, I did see that you did have some several moles. So when we're assessing the nevi, we use the ABCDE assessment, so to speak. So the A stands for asymmetry, and I think that's kind of self-explanatory. So B stands for borders, irregular borders. So instead of the moles just being round, they can be jagged on one side. C stands for color variation. So when you see a mole on your skin and you're used to seeing it a certain color, but over time you realize that, oh my gosh, it looks very different, that's something you know that you probably want to bring to your provider. We also, D stands for diameter, so anything over 5 millimeters is something that we get concerned about. And E stands for evolving or rapidly changing. So, you know, if you have any nevi on your skin and you see that, you know, you're experiencing any of those things, again, you probably want to get to your provider and just kind of get assessed. All right, so that was skin. All right, so we're going to take a look at your fingers. I'm also looking at your fingers. I'm checking for a cyanosis, which you don't have. So I'm looking for clubbing, which you do not have. So while I'm here, I'm just going to go ahead and test your capillary refills. So we're looking for less than 3 seconds. Okay, and you nailed it. So next we're going to move on to your head. So when we do our assessments, we start from head to toe. Again, I'm looking at your hair, I'm looking at your skin texture, your hair texture, I'm looking at the distribution. So I'm going to palpate your scalp here, okay? And what I'm doing is I'm assessing the shape of your skull, and I'm also feeling for anything that we wouldn't expect, like any sort of lesion or masses or nodules. Okay, and so you're good. All right, so then we are going to move on to the eyes. So I'm going to start by assessing your eye. So what I'm going to do is I'm going to pull your lids down. Okay, so I'm checking for your sclera, and I'm also checking your conjunctiva. Sclera is white, your conjunctiva is pink and moist, what we would expect. I can see your iris, and your iris is a lovely shade of blue, and I can see your pupils as well. All right, I'm looking at your eyelid. I'm looking, I can see that they close all the way. I'm checking for any growth or any size on there, and you look good. All right, so I think at this point, we're gonna go ahead and we're gonna assess you for cranial nerve 2, which is the Snellen chart, which is an eye exam, okay? So I'm just gonna ask you to follow me. Take a couple steps here. All right, so what I want you to do is I want you to cover one eye, and I want you to read the smallest line that you can see without straining.
FDPLZ. Yeah. Wow. Hold on. DEF. I just changed.
That's okay.
FELOPZD.
Okay, fabulous. All right, so I want you to cover your other eye and repeat.
DEFPGTEC.
Okay, all right, well, you got most of them, so you get credit. So your left eye is, looks like 20/25, and your right eye is 20/20. Okay, wonderful. You can go ahead and you can have a seat. Okay. All right, so while I have you here, we're going to do a couple different eye exams, okay? So I am going to shine, what I want you to do first is I want you to look straight ahead into the distance, okay? I'm going to shine a light in both eyes. Okay, perfect. All right, now what I want you to do is I want you to, with your eyes only, don't move your head, is I want you to follow my finger as it gets closer to your nose. Okay, that's perfect, all right. So next we're going to check your extraocular vision. So again, what I want you to do is I want you to, with your eyes only, don't move your head, I want you to follow my finger, okay? Okay, perfect. Alrighty, so last test we're going to do is checks for accommodation and consensual. Okay, so I'm going to shine the light in your eye twice. I'm going to do that with both eyes. Okay, almost done. Perfect. You did perfect. Okay, all right. So I'm going to grab my ophthalmoscope and I'm going to take a look at your internal eye, okay? I'll try to be quick because I know it's not comfortable having a light shine in your eye. All right, so right to right. All right, I'm going to come in a little bit closer here. All right. I see your red reflex. Okay, let me get a little bit closer here. All right, I see your optic disc. Oh, I see some veins and some arteries. Oh, and I see a little freckle in this eye. Interesting. Okay. All right. Wonderful. Okay. Now we're going to do the other eye.
Right. Interesting.
All right.
see her. All right. Okay, I see some drusen bodies in there. All right, no papillary edema. Okay.
No.
Oh, sorry about that. I wouldn't have been able to see anything. Okay. Perfect. Let me see what else. Okay, so next we're going to move on. Like I said, we start head to toe. So we did your eyes. Next we're going to do your ears. So I'm going to take a peek in your ears here, and I'm just looking for any obstruction. Okay. All right. So I want you to hop off the table for me. Okay. All right. And I want you to turn around. That's fine. Okay. So I'm going to stand behind you, and I'm going to whisper some words, and I want you to repeat what it is I've said.
25. Apple.
Oh, actually, no, my mistake. Let me get you to include one of your ears. Okay. Baseball.
Baseball.
919.
919.
Okay, now the other ear.
Apple.
717.
717.
Okay, perfect. Perfect. All right, so you can go ahead and have a seat up on the table if you would like. All right. So this is a tuning fork. The first test I'm going to do, I'm going to strike the tuning fork and I'm going to put it on the top of your head. And I want you to tell me if you were hearing it in both ears or just one ear or not at all. Okay?
I heard in both ears.
Perfect. Okay. All right, now this next test, I'm going to strike the tuning fork and I'm going to place it on your mastoid bone, which is the bone right behind your ear. I want you to tell me when it stops vibrating, okay? And then I'm going to place it in front of your ear. All right?
Stopped.
Okay. Hear anything?
Yes.
Okay, perfect.
Nothing. Nothing. Oh, there we go.
Okay.
Yeah. I hear it. It's gone.
Okay.
Okay. Yeah.
And you can still hear it?
Yep.
Okay, that's perfect. That is absolutely perfect. Okay, all right. Next we're going to take a peek at your nose. All right, and I'm just going to do a physical inspection. So your nose is midline, which is what we would expect to be. So what I'm going to do, I'm going to use this and I'm going to take a peek up your nose, okay? All right, can you tilt your head back just a little bit? Oops, that was on. There it is. Okay, I can see your turbinates. And I don't see any polyps. Your mucous membranes here are pink and they are moist, which is good, which is what we're looking for. Okay. So, all right. All right. So what I want you to do is I want you to close your eyes. Okay, I'm going to give you 2 things to smell, and I want you to tell me what it is. Okay, first.
Vicks.
Okay, very good. Okay, eyes closed. Sniff.
Coffee.
perfect. You can go ahead and you can open up your eyes. Let me see what else we're going to do with your nose. I can't think right now. Okay, all right. So while we're here, I'm going to assess your frontal sinuses. So I'm going to put a little bit of pressure here. Any tenderness?
No.
Okay. Go check your maxillary sinuses. Any tenderness?
No.
Okay, perfect. All right. So moving down, I'm gonna assess your mouth. So if you don't mind, let me get you to just open up your mouth for me. Okay. All right. I'm looking at your hard palate. Okay. Can you pull your cheek apart a little bit? I just want to check your buccal membrane. Okay. Next one. Other one. Okay. All right. And pull down for me. Okay, all right, so your lips are fine, they're moist, they're intact, your teeth are fine. Let me get you to open up your mouth again. I want to take a look at your tonsils. All right. Okay, so I would probably say that they're a grade 1, which means that they're taking up about 25% of your throat. I also was able to visualize your anterior and posterior pillars. They look fine. Let me see your tongue again. Okay, all right, your tongue looks fine. Let me see what else we need to do with your mouth. Oh, okay. So what I want you to do is I want you to take your tongue and I want you to push on the side, and I'm going to apply some pressure, resistance. Okay, now the other side. Okay, perfect. All right, you're doing so great. All right, so we are, next we're going to move on. We're going to assess your neck. So I'm looking at the skin, I'm looking at your, I'm looking at your trachea. And your trachea does appear to be midline, but we're going to go ahead and we're going to test for that. So what I want you to do is I want you to take a deep swallow for me. Okay, perfect. I'm just going to apply a little bit of pressure here. Okay, and here. Okay, so I am able to move it, but it does return to the midline, which is what we would expect. So nothing, no issues there. All right. So I didn't realize this table was going to be so high. So let me get you to take and have this seat right here for me, dear. I'm so sorry. All right. So what I'm going to do now is I'm going to check your thyroid. Okay. So what I'm going to do. Okay. Let me get you to take a deep swallow. Okay. Perfect. All right. So you can come on back up here. That'll be fine. All right. So I did feel the isthmus rise and return to its place. So that's good. I don't see any goiter, any enlargement. So we're good on that. All right. So next we're going to go ahead and I'm going to assess artery here. Okay, all right. Slide down here. We're going to check for TMJ. So I want you to open and close, okay, and move your jaw side to side. Okay, are you having any pain with that?
No.
Okay, perfect. All right. We'll go ahead. I'm going to do your glands. So we're going to do anterior cervical, posterior cervical. And then we're going to do occipital, which is going to be at the base of your occiput. Okay, all right. So we're going to do the tonsillar, your submandibular, and your submental. Okay? We're not finished, so we're going to do your anterior cervical. All right, and we're going to do your posterior cervical, okay? And then we're going to check your supraclavicular, Okay, and I'm not seeing any masses, so everything seems to be okay. Let's see. Eyes, nose, mouth, throat, trachea. So while I'm here, I'm going to go ahead and I'm going to assess your carotid artery. I'm going to auscultate it. No buoy. Perfect. Okay. So at this time, I would assess for JVD, but we're actually not measuring that. Okay. So we are going to move on to the thorax. Okay. So what I want you to do is, if you don't mind taking your shirt off for me. Okay. So I am going to assess your anterior chest. Everything looks fine. Your A to P ratio is 1 to 2. And I'm going to palpate your sternum for any pain or tenderness. Oh my goodness, you have a bruise right here. Okay. It's a little bit out of order. Have you noticed any changes over in the skin over your breast?
No.
Okay. Have you noticed any lumps or any dry skin, rashes, any nipple discharge?
No.
Okay. All right. I'm so sorry I forgot that. Okay. So what we're gonna do is I'm going to inspect your back. I'm inspecting for symmetry. I'm going to palpate for any pain or tenderness. Okay. Mr. Goulet, if you don't mind shifting so that your back is a little bit towards me. Okay, thank you. I apologize. Thank you so much. Okay, so we are going to start with respiratory excursion. Okay, so let me get you to cross your arms over. Okay, that's fine to make yourself comfortable. Okay, so what we're gonna do, okay, I'm also gonna palpate your intercostals here for any pain or tenderness. Okay, all right, you can put your arms up. No, go ahead and put it back up on your shoulders for me. There you go, dear, thank you so much. All right, so what I'm gonna do, pinch up a little bit here. So I want you to take a deep breath and then exhale. Okay, perfect. All right, you can go ahead and put your arms down. All right, so now we're gonna, I'm gonna palpate for tactile firmness. All right, so every time I repeat the word, every time I move my hand, I want you to say 99, okay?
Mm-hmm.
All right?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. All right, so next we're going to palpate, or I'm sorry, we're going to percuss. All right. going to take a listen. All right. Deep breath. Exhale. One more. Okay. Once more. Okay. Once more. Okay. One more. Okay. One more. Okay. Once more. One more. Okay. One more. All right, and one more. Okay, perfect. All right. So now we're going to, that's okay, you're fine. We're going to go ahead and start with your anterior chest. So what I'm going to do is I am going to palpate the anterior of your chest for any pain or tenderness. Are you having any?
No.
Okay, perfect. All right. Actually, you know what? Stay right there. I did forget to do one test, and that was for diaphragmatic excursion. So I'm so sorry. Let me get you to shift your hips again. I do apologize. Okay. All right. So. Okay, all right, right here. Thank you. Thank you, Jocelyn. Okay, so. Okay, all right. All right, so we're gonna assess for respiratory excursion. Okay, so pinch some skin here. All right, take a deep breath. Okay, exhale. Okay, perfect. Okay, gonna place my hand and I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. All right, so we're gonna go ahead and percuss your fields. Oh, sorry. Okay. So second left intercostal, say aortic valve. Actually, second right is the aortic valve. Second left is pulmonic. Third intercostal is Erb's point. Okay, mitral valve is at the lower left border. Okay, and the tricuspid valve is at the apical. Okay, all right, let me go ahead and get you to lay down, Mr. Boulay. I'm so sorry, I know it's not very comfortable. Right. Okay. Okay, perfect. So we're going to move on to the abdomen, and I'm assessing for contour and any pulsations that might be present. Okay. So I'm going to auscultate each field. Okay. Okay, I'm also going to assess the arteries. Iliac, or this is a renal. Iliac. Okay. Femoral arteries. Okay, all right. So we're going to go ahead and percuss. Okay, all right. Then we're going to start with the light palpation. And we're going to go with the deeper palpation. Any pain or tenderness?
No.
Okay, all right. We would palpate the spleen, and then we would percuss the spleen, and then we will percuss the liver, and also costal vertebral area. Okay. All right. Also for the kidneys, but it's not usual to be able to palpate them. Okay. All right. Okay, can you go ahead and stand up right away? All right.
Stand up?
Yeah, go ahead and stand up. You can go ahead and put your shirt on if you'd like. All right, okay, so moving on to musculoskeletal. Okay, so what I would like you to do is palpate back and the spine for tenderness or any pain. Okay, so what I'd like you to do is bend forward as far as you can.
Like all the way down?
If you can, sure. Don't hurt yourself. All right, so I'm assessing for scoliosis, and there is no scoliosis visible. Okay, all right. So we're gonna check your cervical. So I want you to look up, look down. I want you to head left and to right. Okay. I also want you to tilt your head, try and touch your ear. Okay, and then the other side. Awesome. Okay, so next we're going to assess your thoracic and your lumbar region. So what I want you to do is, I know you just did it, I want you to bend over a little bit for me. Okay, and I want you to stand up. Okay, I want you to lean back. Okay, I want you to bend to each side laterally. Okay, and I want you to rotate your upper body. Okay, perfect. Awesome. Okay, so we move on to the upper extremity. So what I'm doing is I am going to assess the arms, shoulders, wrists, and fingers. Okay, all right. Any pain, tenderness?
Nope.
Okay, arms over, or arms out to your side and over your head. Okay, arms in front and over your head. Okay, I want you to give yourself a hug. Okay, I want you to put one hand behind your head like you're brushing your hair. Okay, same thing. Okay, I want you to take one arm and try and grab your back. Okay, and do the same thing with the other one. Okay, perfect. Now, elbows. Bend your elbow and extend your elbow. Palms up, palms down. Let me get you to turn towards me a little bit. Okay, perfect. Palms up, palms down. Okay, great. You can go and put your arms down. Actually, pull them back up. So, what I want you to do, or actually, yeah, I want you to turn your thumbs down. Okay, make fists. What I'm going to do is I'm going to try and push your arms down. I want you to resist. Oh my goodness, you're strong. Perfect. All right, so with the wrists. Wrists down, fingers up, fingers out, and fingers in. Perfect. All right, now we're going to assess your fingers here. So what I want you to do is I want you to take your thumb and point it at the base of your pinky finger. Perfect, okay? Now I want you to take your thumb and tip all of them. Okay, perfect, all right. So now what I want you to do is I want you to take your pointer finger, actually all your fingers, and I want you to bring it down to your thumb, okay? And open it back up. All right, perfect. So I want you to, I want you to go ahead and grab my 2 fingers here, okay, as tight as you can. Okay, perfect, excellent. All right, so what I am going to do is, I've got 2 items here. I want you to close your eyes. I'm going to touch you on your upper extremity. I want you to tell me if it's dull or soft.
Soft.
Or
That's hard. Dull. Soft.
okay.
Dull. Dull.
Okay.
Soft. Dull.
Okay. All right. Perfect. Very good. All right. So next we are going to assess your lower body. So looking at your hips, your knees, and your ankles and your toes. So I'm going to palpate and I'm checking for any pain or tenderness. Okay. Oh, actually, you know what? I'm so sorry. Have a seat. We got to test your reflexes. All right. So we're going to start with your brachial. Okay. Just relax this arm. Nope, nope. Just let it go loosey-goosey. There you go. You can turn it. Okay, now the other one. Okay, all right. And we're going to do your tricep. Oh, I'm so sorry.
You're okay.
Oh. All right. Okay, nope. Bend it a little bit. Okay, all right. And then we're going to do your radial. super. All right. All right. So I want you to lay back on the table for me. Okay? We're going to assess your hips. So I want you to go ahead and pull your knees up to your stomach. Okay? And you can let them relax. Okay. All right. So you can go ahead and sit up. All right. So what I want you to do is I want you to extend your knees. Okay? And put them down. Excellent. All right. So for your feet, or for your ankles, what I want you to do is I want you to point your ankles down, point your feet down, up to the sky, okay? And I want you to evert, okay, and away. Okay, perfect. All right. So next we're going to assess your patellar reflex, and then we're going to do your Achilles tendon, and then we're going to do your Babinski, okay? All right. Okay. Now the other one. Okay. Let me get you to take your socks off for me. All right.
Snow?
Okay, so that's a positive Babinski. All right. Okay. All right, positive. All right, we'll just keep this off for a minute. All right, so I'm going to touch you on your lower extremities. I want you to tell me if it's dull or soft and where you feel it.
Inner thigh, dull.
Okay.
Calf, soft.
Okay.
Medial, I think it's dull. Top, dull. Soft, dull.
When you're saying dull, do you mean sharp?
Yeah, because you said dull, the word dull.
Oh, I'm so sorry. My mistake. Okay. Alrighty. So we're supposed to assess your gait and your balance. And we did that. I noticed that when you came in. So I don't see any problems with your gait or with your balance. All right. Also out of order, let me get you to turn around here for me.
I don't know. I can't see it.
Actually, okay, that's it. That's our exam.